Hi, welcome to this edition of our neurometabolic video series. Today's layout is going to be a little bit different than what I normally do. Today I'm actually going to go through my thyroid recovery workshop. I have a lot of patients who try to attend our workshops that we have here in the office, but they can't make it for some reason. Life gets in the way, it's too late at night, kids, so on and so forth. And I've had a lot of requests for me to record the video of the workshops and put it online. And we tried to do that a couple times, but for some reason the audio isn't coming out right. And it's kind of hard to see, what's being written on the board. So I thought I'd take a break in between patients today and go ahead and record an edition of our thyroid recovery workshop so that you can experience it at home and see if this might be a fit for you. Now, just kind of as a preface or an introduction, most of the patients that come into our office for relief from symptoms that are related to the thyroid gland are usually people who are suffering from conditions such as hair loss, oily skin, intolerance to cold, can't lose weight or weight gain, just different things that make them suspect that they might have a thyroid issue. A lot of patients are already diagnosed with a thyroid issue and they're on medications, but what happens is that those people who are not on thyroid medications, they go to their doctor with these symptoms thinking, hey, there might be something wrong with my thyroid. They run the lab tests are normal, and they say there's nothing with the thyroid. Or patients who are on the medications and their lab tests may be getting to normal, but they still feel poorly and they don't understand why they're still having symptoms. So that's the goal of the workshop, is to explain and help you understand the mechanisms behind why this is happening and honestly what you can do about it. Now, in the email that I sent you, I had an attachment with some forms on it, okay? You need to fill these forms out before you watch this workshop, okay? Because as I go through this, these forms are going to apply to you and they're going to help you figure out how you're doing. This is an interactive workshop. So if you have not filled those forms out, go ahead and pause the video, go get those forms filled out, and then come back and start the video again. You're also going to want a white piece of paper so you can take some notes, okay? Now, if you have any questions as I'm going through this, you can email me. My email address is drpricedc@aol.com. Okay, you can always email me at that email address and I'll get back to you as quick as I can. Okay? Okay, so let's get started. The basic principle behind everything that we do in our office, and if you had to stop this video in the next 5 minutes, the basic concept that I want to make sure that you got is that your body is designed to heal itself. Your body is a self-healing organism, okay? So on your white sheet of paper, I want you to write self-healing. Because your body is absolutely designed to heal itself, okay? Now, there are a couple things that have to happen. There are some challenges that can get in the way of that healing process, and that's what we experience. So the first thing that has to happen is you're going to draw a line over like this, and you're going to draw yourself a little snow cone. Okay, this is going to represent your central nervous system. So Gray's Anatomy, which is the end-all be-all of anatomy and physiology books, states that the brain controls and coordinates this function of every cell in the human body. Okay, now take that in for a second. The brain controls and coordinates the function of every cell in the human body. So if the brain is not functioning right, or if the message from the brain going out to the system is not getting there appropriately, then you can't have proper function in the body. If you can't have proper function in the body, then you cannot have proper healing. So we've got to make sure that we have that central nervous system functioning properly. The other aspect that we have to look at is we have to look at the gut. Because 80% of your immune system is actually in your gut. And you're going to understand a little bit more about that as we go through this process. So if there's a problem with the gut, well, how do you have a problem with the gut? There are several things that can cause issues with both the brain, the spinal cord, the central nervous system, and the gut, and there are challenges that can affect that. The number one challenge is stress. Now, everybody has stress. If you're married, if you have a job, if you have kids, if you live, you're going to have stress, okay? There are three types of stress. You've got physical stress, you've got chemical stress, and you have emotional stress. All three of these stresses in your life will affect the gut and the central nervous system, and they can cause problems. And we're going to go a little bit into the stress response as we go through this, and you'll understand if you're being affected by that stress. So stay tuned. Stress is item number one. Number two, inflammation. In our society, we live a very pro-inflammatory lifestyle. If you eat the standard American diet, if you're eating foods that you might be sensitive to, if you're overworking out, if you're under stress, if you're exposed to chemical toxicities, blah, 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 on, you could have chronic inflammation in your body. And it's a very, very common issue in your body. And inflammation in your body is like a blowtorch. If you take a blowtorch and you put it to your TV at home, it's not going to be good for your TV. Well, you can imagine that inflammation happening to every tissue in your body when you're chronically inflamed. So we have to find out if you're inflamed, and we have to try to fix that. One of the main causes of inflammation is your blood sugar and how your blood sugar is being handled. You've got to handle that blood sugar properly. Blood sugars that go in and out of the normal ranges, they're going to cause trouble. How do you know if you have a blood sugar issue? Well, a lot of you already do because you've had labs run, but if you don't know, we're going to show you today how you can figure that out. So it's important, fill out that questionnaire. Again, if you have not filled out those questionnaires that I attached to this video, stop the video, go get them and fill them out, because we're going to go through this and help you figure out what's going on with yourself. Okay? The next challenge are antigens. Okay, well, what's an antigen? An antigen is a bacteria or a virus. It could be subclinical that's in your body that has gotten out of balance within your body. It could be a fungus. It could be a parasite. There can be a lot of issues that can be causing inflammation in your system and can be causing challenges to your health and challenges to your gut and to your nervous system and how they're functioning. Excuse me one second. Again, this is a raw video, so bear with me. I got papers over here and I might drop them sometimes. So you've got to make sure that there's not a parasitic issue going on there. Okay? Anemias. If you have an anemia indicates that the blood cells in your body are not able to transport oxygen to the tissues to allow proper functioning to happen. So if you've got anemias, whether it's an iron anemia or a folate anemia or some kind of anemia that's going on, and it's a subclinical anemia, you could have problems with your gut and with your immune system and with your central nervous system even. You can have a lot of troubles, and these things will keep you from being able to heal. You also have the main issue that we have to look for is we have to look at issues that could be indicating autoimmunity. And if you are truly a hypothyroid patient, chances are there's an autoimmune condition going on. How do you know? I'm going to show you how to know here in just a few minutes. Okay, so basically, in order for your body to be able to heal itself, you have to have a healthy functioning nervous system and a healthy functioning gut. If you don't, then your body will not be able to exercise that ability in itself to self-heal. And these are some of the challenges that can keep your body from self-healing. You can also have heavy metal toxicities and different things like that. But these are some of the things that can keep you from doing that. Okay? Now notice, I have not even talked about the thyroid gland yet. And the reason I haven't talked about the thyroid gland is because you have to focus when you're looking at healing, you have to focus on cause versus effect. And a lot of times when you're going after the thyroid gland and what's going on in the thyroid gland, you're chasing a symptom, you're chasing an effect. But you have to get to the cause. Why is that thyroid gland malfunctioning? In the case of diabetes, type 2 diabetes, why is the pancreas not functioning? In the case of type 1 diabetes, why is the pancreas not functioning? You have to keep asking why until you get to the cause. A lot of times these can be the causes. A lot of times you can have several of these causes in like an onion. So you might find that there's some autoimmunity and you start trying to get that under control, and that kind of peels away, and then you find that there's a blood sugar issue, and then you find that there's some antigens. Most people have many of these things going on, and you have to get in there and you have to assess them and address them in the order that the body wants it to be addressed. And that's what we do here in the office, is we get in there and we assess these things. Okay, I'm trying to make sure I don't run over here too much. All right, so with the thyroid gland, it's very important that you understand the metabolic processes and how this works. But first I wanted you to get this general idea down here. Now, our goal in the office is not to manage symptoms. Our goal in the office is to change your life, to reinvent your life. And the way that we do that is we get in here and we start addressing this stuff, and you would be amazed at what your body's potential is and how you could actually be living. If you're living below what you want and you're not reaching your God-given potential, it's because you've got some issues going on that need to be resolved. And we can help you with that. Okay, but you need to understand like how the thyroid gland works, what the metabolic process is for the thyroid gland. Okay, so here's how this works. You have the hypothalamus, and the hypothalamus sends a hormone to the pituitary gland called thyroid releasing hormone. That thyroid releasing hormone tells the pituitary gland to go ahead and release thyroid stimulating hormone, which is what most people are familiar with, TSH, and that tells the thyroid gland to do its thing. Okay, so what is its thing? Well, the thyroid gland then releases T4 and T3. Okay, now T3, these are the two thyroid hormones. T3 is the active version that the body can actually use. Coming directly from the thyroid gland, it's only about 7%. Okay, the rest of it comes in the form of T4, which is about 93%. So the hypothalamus has a feedback mechanism, and basically what it does is it can read in the blood how much T4 and T3 is in the blood. And when there's enough of that, it sends a message to the hypothalamus. Hypothalamus says, hey, okay, there's enough of this. It cuts off or reduces that thyroid releasing hormone, which really reduces the TSH, which keeps everything in balance. So for when you go to the doctor, when they run the labs, if you have a high TSH, that tells us that the hypothalamus is not registering enough of this in the blood, so it's telling the pituitary to keep on producing more and more TSH. And that's why you have high TSH, and that would indicate low thyroid function. So what the medical doctors are going to do is if they come in there and they see that you have this this high TSH and your thyroid is functioning at a hypo level, they're going to give you Synthroid, levothyroxine, or Armour, which is a synthetic version of this T4, and they're going to get that T4 level up so the hypothalamus reads that and it brings your TSH levels down. So that's how the medical treatment is. Sometimes they might use Cytomel, which is a T3, a synthetic T3. They don't use it a whole lot here in the States, but sometimes they'll use that. And again, the attempt is to try to get the TSH level within normal range. Now, while we're talking about normal range, I want to discuss that for just a second. If you go to the lab and you get your lab values done, the way that your lab values are figured out is they take the conglomerate of all the patients that come in and they figure out what's normal. Well, how do they determine what's normal? Well, they take what everybody does and they kind of average it together and they find a midline, and then they look at some other factors as well, but they'll set this normal range. So for the TSH right now, normal is 0.5 to 3.5. That's normal, clinically normal. Okay, but you have to take into account that that is not optimal. That is normal to the lab value. Anything outside of these ranges, they determine that to be a disease process. So what we look at nutritionally and with functional nutrition is we look at what's optimal. And for us, it's 1.8 to 3.0. So let's say that you go to your medical doctor and they run your labs, and let's say you're sitting right here at about 3.2. Well, he's going to tell you that your lab ranges are normal, and they're not going to do anything for you. But you're having all these hypothyroid symptoms. Well, we're going to look at it and say, okay, you're in the motion of going towards hypothyroidism. We need to explore this further and see what's going on. Okay, so I just want to make sure that you understood that. So even though your lab values may be normal for what you ran for your medical doctor, we still need to evaluate them because we need to evaluate it from a functional medicine and a functional nutrition point of view so that we can determine, yeah, you may be normal, but are you optimal? And if you're not optimal, let's go ahead and handle it now because it's easier to fix something here than it is when you're getting further and further down the line. I've seen TSH levels in the 20s and 30s. I mean, I've seen them in the hundreds at one point, a really, really chronically sick person. So it's easier to fix it when it's within this normal range still, but outside of the functional range. So that's item number one. Okay. So what happens when that T4 comes in? Well, here's the key. Okay, it gets into a little taxi cab. All right, we're going to call that taxi cab thyroid binding globulin. And we're going to draw a little taxi cab here. Okay, and that taxi cab takes this T4 to the little central processing plants to help it be converted. So it goes to the liver, it goes to the gut, and it goes to the other peripheral tissues. Now when I say other peripheral tissues, There are thyroid receptors in every cell in the human body. That's why people who suffer from thyroid conditions, or they're not converting this T4 properly, have such a wide array of symptoms, even down to brain fog, because it can affect your central nervous system. Okay, so it goes out here, and these are the areas where the processing happens for you to get your active T3. And once you have that active T3, then that T3 must get into the cell, and there are certain nutrients that are required for that T3 to enter into the cell, and that's when normal metabolism happens. Okay, so there's a whole lot of stuff that can happen here that in this process that is down river, I guess you could say, from that T4, T3 level that happens right here. So that's why so many people who are going in for treatments with for thyroid conditions, even if they're on the right medications, they get that T4, they get their TSH level to normal. Well, they're not feeling well because there's something going on in all these other processes that are not being addressed by a single medication. I hope that makes sense to you. Okay, so this is the basic thyroid metabolism. Now, there are 6 thyroid patterns. I'm not going to go into too much detail on those right now. If you want to learn more about those, there's a video on my website. It's drshawnprice.com. My first name is spelled S-E-A-N. If you go to drshawnprice.com, and on the top of the website, you'll see Dr. Price's videos. You can go in there and you can see the thyroid patterns, the 6 thyroid patterns, and you can see that's in pretty good detail. It's a video that I shot. But of these 6 thyroid patterns, there's only one that is actually helped completely by synthetic hormones. And that's what we call primary hypothyroidism. And that's the condition where, for some reason, the thyroid gland is just fatigued. It's just not making enough. Everything else is working like it should. The conversion factors, pituitary, all these other things are working like they should. But for some reason, that thyroid gland is just underperforming. So when these patients go in and they get that Synthroid, they take it, their life totally turns around. They get their energy back, they start losing weight, they start sleeping better, the brain fog clears up, all these symptoms go away. Okay, so that is what we call primary hypothyroidism, and if you're one of those patients, then that's great that you feel a whole lot better. You still have to ask the question why. Why was the thyroid gland not functioning properly, and still address that, but at least that Synthroid is helping for those patients. All the other patterns, Synthroid alone, number one, it may not even be necessary, but number two, it may not be helping, okay? And especially in a condition of autoimmunity, which we're going to go into in a few minutes. And again, if you want to find out if you're autoimmune, you got to stay with the video because I'm going to go into it and help you figure that out. So yeah, that's the thing. You have a 17%, if you take into account 6 patterns, there's an 83% failure rate that you're going to not get helped by medication alone. Because only about 17% of the patients do. Now here's another kicker. The autoimmunity, there is a doctor named Dr. Datis Karazian. He's a thyroid specialist. Dr. Karazian says that anybody who is hypothyroid, of those people, 90% of them are autoimmune. So there's a strong chance, and I see that in my office as well, there's a strong chance that you got some autoimmunity going on. Okay, so this is basic thyroid metabolism. I'm going to leave this up. Hopefully you've written this down on your form. Hopefully you filled out your questionnaires, because we're going to go into those now so you can figure out what your challenge might be. Okay, so what I want you to do is I want you to draw a circle. Make sure I can stay in the video here. I want you to draw a circle on your white page, and I want you to write the word thyroid, or whatever symptom it is that you're concerned about, whether it's fatigue, it's weight loss, weight gain, diabetes, whatever it is, chronic pain. I want you to write that, draw a circle and write that in there, okay? Because that is your symptom. And what I'm going to explain to you is why you think you're suffering with this, which is your effect. I'm going to show you if you might be suffering from a cause, could be related here or something else along the way. Okay, so the first form I want you to get out is the form called the neurological assessment form. I'm covering up the patient's name here, so I got to keep that private. The neurological assessment form, it has a bunch of yeses and nos on it, okay? I want you to pull that form out, and I want you to count how many yeses you circled on that form. So go ahead and do that for me. Count how many yeses you circled on that form. Okay? If you have to pause the video, that's fine. Go ahead and pause it. But once you've counted that number, go ahead and write it on the bottom of the form. Now, next to that number, I want you to write the word optimal, okay? Now, the optimal number of yeses that are allowed on that questionnaire is 5. Okay, most people are probably thinking, oh God, I got a brain problem. And if you circled more than 5, then yeah, you do have a brain problem, especially if you got into the 10s, 20s, and some people get up, greater than 20. So if you circled more than 5 on that questionnaire, then what you're going to do is you're going to go to your thyroid circle here, or whatever your symptom is. You're going to draw a line and you're going to write the word brain. And that tells us that you have a brain issue. Okay? Now what does a brain issue mean? Well, there are 3 primary lobes in the brain that we talk about. There are, a lot of functions in the brain, but, we talk about the frontal lobe. The frontal lobe is our personality, it's our social skills, it's our logical thinking area. If you find that you're making not logical thinking, I'm sorry, decision-making process. So if you're finding that you're making poor decisions in your life, if you find that maybe your personality is changing a little bit, you might have a frontal lobe degeneration issue. Now, for example, teenagers, our frontal lobe doesn't completely develop until we hit our early 20s. So kids will walk up to a lady that's wearing an ugly dress and they'll say, that's an ugly dress. And they don't mean to be mean, it's just they haven't developed the social skills because they haven't myelinated that frontal lobe. Teenagers are a great example because they do things that are so irrational, they feel so invincible, and as a parent of a teenager, I can say that this is a very personal experience. But they've got these hormones going, and they don't have the social skills, so that's where that challenge comes in as a teenager. So that's the frontal lobe. Now, you have the parietal lobe. The parietal lobe is our sensory area. For example, you're sitting here watching this video, you should not be feeling any pain. If you drop a hammer on your toe, that's supposed to hurt. Yeah, that hurts, that's okay, that's a normal function. But if you're in chronic pain, that tells us that there's something along that neural pathway in the parietal lobe, or the nerves that come in and feed the parietal lobe, that there's inflammation, that there's some kind of a challenge that's causing those pain signals to be hypersensitive, and we've got to figure out what that is. Again, these challenges in here are a big part of why that could happen. It's called transneural degeneration. Your temporal lobe is your short-term memory lobe. If you go to Walmart or the grocery store and you come out and you can't find your car, that's a temporal lobe issue. If you start to say something and can't remember what you were going to say, or if you go into a room and can't figure out why you're there, can't find your keys, different things like that, those are all short-term memory issues for the temporal lobe. Now I'm going to write down temporal lobe because that's going to become kind of significant here in a couple of minutes. Okay, so if you circled more than 5 on that neurological assessment form, then you have a brain issue. Okay? Now, pull out the next form, which is the metabolic assessment form. This is the one with all the 0s, 1s, 2s, and 3s. Okay? Now look at your form, and again, if you have not filled these forms out yet, please go ahead and fill them out. This is very important. Take the forms. Category 1. If you circled any 1s, 2s, or 3s in category 1, you need to write the word colon. Okay, so go ahead and do that. If you circled any 1s, 2s, or 3s in category 1, write the word colon. Watching my time here. Okay? If you circled any 1s, 2s, or 3s in category 2, you're going to write stomach. Actually, in categories 2 and 3. You're going to write the word stomach. Okay, this could be a stomach acid issue. A lot of patients will have issues with acid reflux, and they'll be taking antacids, and that's actually the exact opposite of what you should be doing, because the reason for most reflux situations is because the stomach acid decreases as we age, so foods sit in the stomach longer, they're allowed to ferment, and that causes that reflux. You have to increase that stomach acid content to increase the digestive processes, so that you can get that food digested and get it moving on. That's why as kids we could eat pretty much anything we wanted to because we had high levels of hydrochloric acid, but now as we age and those levels drop, you start experiencing challenges. Now you take these antacids, you're going to lead yourself into all kinds of problems, malnutrition because you're not dissolving your nutrients right, you're going to feed the problem of what's going on, and it's going to become an issue where you become dependent on those antacids, and then you start dealing with other issues down the line because of malnutrition and poor absorption. Okay, so that's a very, very important factor there. If you have any positive 1s, 2s, or 3s and 2 and 3, even if the rest of your scans are clear, you need to get in here and see me so that we can get that hydrochloric acid levels balanced out. Okay? Category 4 is your small intestine. This is very important because this is where all of the assimilation happens. Assimilation is where your body takes the food that's being digested, it assimilates it, the nutrients, into your body for your bodily functions. If you're having problems there, then you're not assimilating your food properly. And here's the other issue with that, okay? If you take these areas and you put a circle around them, this is your gut. And remember, your gut is 80% of your immune system. Okay, so we've just addressed the two main areas that affect your body's ability to heal itself. If you have drawn these lines and you have these areas that are a problem for you, then your body's ability to heal itself is being hindered, and it cannot happen. You can take all the Thyroid in the world that you want to. You can do all of the miracle supplements that you want to. You can do all of these things, but if you're not addressing whatever's going on here that's causing these problems, you will not heal properly. Okay, that is very important that you understand that. You will not heal properly. You cannot medicate yourself back to health. You can medicate yourself to manage symptoms, and in some cases it might be necessary, but as far as healing the body, you have to address what's going on. And we just showed you that you might be having issues with the primary two systems that keep your body from healing itself. Okay, it's very important that you understand that. Now, also with the gut, if you have an issue there, remember I talked about autoimmunity. And honestly, autoimmunity trumps everything. If your body is autoimmune, that means that your immune system is overactive and it is attacking itself. And it needs to be addressed because you can't heal if you're in an autoimmune flare-up or an autoimmune condition. So what is autoimmunity? Well, basically what will happen is, this is a very, very basic explanation, but this is your intestinal lining, okay? As the food digests, comes out of the stomach and gets into the small intestines, it's kind of big like this, but it'll keep on being broken down as it goes through the process. It gets smaller and smaller and smaller. Now these proteins will go through little pathways in the intestinal lining, and that's how it gets into the blood and goes to the tissue for the body to use it. Okay? If you have chronic inflammation, if you have symptoms in this area, and that is allowed to continue long enough, what will happen is these pathways will start to get bigger and bigger and bigger, and they'll start allowing these bigger proteins into your bloodstream. When those bigger proteins get into your bloodstream, that's foreign to the body. Those strands of proteins are now antigens. So the body makes antibodies to defeat those antigens. So it makes an antibody, the antibody comes in and it attacks it. Now let's say that this protein is something from the food that you're eating. Let's say it's corn, for example. You're constantly eating this corn because you like corn, or because you're drinking a lot of soda, so you have high fructose corn syrup, or whatever it is, but you're getting this high influx of these corn proteins in there. So the body makes these antibodies, and let's say that that protein chain that's in that corn, or gluten, which is another really good example, the protein is similar to a tissue in the body. Most people who are hypothyroid and are autoimmune hypothyroid, which is Hashimoto's thyroiditis, most people have gluten sensitivities and are constantly eating it because it's in so much of our food supply. That gluten sensitivity feeds these antibodies, and these antibodies go right around here and they constantly attack the thyroid gland. If they attack enough of the thyroid gland doesn't function properly, and you can take all the Thyroid you want all day long, you can get your lab values back to normal all day long, but unless you address that autoimmunity, your thyroid gland is constantly being destroyed. Same thing with other autoimmune conditions. There are a world of autoimmune conditions, and if those antibodies are allowed to continue, you don't just have a thyroid issue. You probably have, some rheumatoid antibodies in there. You probably have a lot of different antibodies attacking a lot of different tissues in the body. Some of the favorite areas for antibodies to attack are the pancreas, the thyroid, and the cerebellum. Cerebellum is going to lead to balance issues, vertigo issues. Pancreas can obviously lead to sugar handling issues, and then the thyroid is what we're talking about. So you have to determine if you have autoimmunity. Most doctors don't run the lab test to determine this. We do. So if anything, you get in here and we do that lab test just to see if you have an autoimmune condition, because it's got to be handled. Okay, so we're on to category 4. Now category 5 and 6. 5 and 6. These are, I want to make sure, let me use my little cheat sheet here. We just changed our questioning. I'm sorry, no, it's category 5. I'm glad I looked. Category 5 is liver and gallbladder. So if you have any 0s, 1s, 2s, or 3s in category 5, you also have a liver and gallbladder issue. Now here's the trick here, okay? We've already talked about that the gut and the central nervous system is not working right. Well, notice that the conversion happens in the gut and the liver for T4 to T3. So if you have an issue here, that conversion may not be happening. That's one of the thyroid patterns. You may be totally normal up in here, but that T4 gets down here and it underconverts because there's something going on in the conversion pathways, and that those factories are not doing what they need to do to get you that active T3. Okay? No amount of Synthroid, Armor, Levo, or Cytomel is going to fix a liver or gut issue. You got to get in there and you got to handle it nutritionally. Okay? Makes sense? No amount of levothyroxine, Synthroid, or any of the other medications are going to fix a brain issue. They're not going to fix a gut issue. You got to get in there and handle it. All right, so that's liver and gallbladder. Category 6 and 7. That's your blood sugar. If you have zeros, ones, twos, and threes in both of those categories, you're what we call an insulin reactor. You have dysglycemia. Your body sometimes is hyperglycemic, sometimes it's hypoglycemic. You're kind of all over the place. This is huge in our society because of the diet that we eat. That blood sugar has got to be maintained within a normal range and got to be balanced in order to help you with insomnia, to help you with chronic inflammation, to help you with thyroid conversion, to help you with normal hormone pathways. With all these different things that you deal with, blood sugar is critical. That's one of the most critical factors. Blood sugar is also very toxic to the brain and the central nervous system if it goes out of its normal ranges. Okay? All right. So that's 6 and 7. Categories 8 and 9. Again, let me check and make sure I'm on the right category path. It is. Those are your adrenal glands. Your adrenal glands are your stress response. This is cortisol. If you're chronically stressed, whether it's an emotional, a chemical, or a physical stress, if you have a high stress job, if you're somebody that's just constantly anxious and you're mad all the time, those are all adrenal responses. Those are all sympathetic fight or flight responses, and you have a chronically high level of cortisol. Chronically high levels of cortisol cause fat retention. They mess with your estrogen levels. They mess with your thyroid conversion levels. Also, chronically high cortisol levels love the temporal lobe of the brain. So they'll start causing the short-term memory issues. Now, what happens if you have a short-term memory loss issue that goes long-term? You get into dementia, you get into Alzheimer's, different things like that. So you really want to handle this stuff now while it's still a smaller issue. How do you determine if you have an adrenal issue? If you circled any zeros, ones, twos, or threes on your questionnaires, and we can explore that further by doing certain labs, and we can actually test your cortisol levels, what your cortisol pattern is, what your hormone levels are. We can get in there, we can measure all this, and then we can address it and do post measurements to make sure everything's looking good. That's done through salivary testing. It's not done through blood work. You may have had your cortisol measured with blood work. That doesn't really tell us a whole lot. We use the salivary testing for that. Okay, and then categories 10 and 11, that is your thyroid gland. And if you're watching this video, chances are you've got a pretty good amount of those circled, especially in category 10, because that's going to be hypothyroid. Category 11 is hyperthyroid. You can have a mixture of symptoms. Patients that are hypothyroid can have what's called a thyroid dump, and that's where these antibodies get in there and attack the thyroid gland enough that they'll hit an area where a lot of these hormones are being made, and those hormones will dump into the system real quick, and it'll pump you to hyperthyroid for a short time. So you can have a mixture of those symptoms. Okay, this is what we call the web of physiological dysfunction. This is how you can determine, without doing lab work, just sitting in your own living room, this is how you can determine if you've got any of these challenges that are impeding your body's ability to heal itself. And I think that for most people, you're going to find that you've got a piece of paper that's got a diagram on it that looks pretty familiar to this. Now, when I do this, it's clear, but I've been doing this work for a long time. I've handled all my issues, family's issues. We've handled all that. That's actually what got me into this work, is my daughter came back as Hashimoto's hypothyroidism, so I had to learn how to do all this. And it is workable. It is fixable. So what do? Well, you got to, number one, you got to determine if this is something you might need, and if your information looks kind of like this, then this is probably something you need to do. Okay. What's the next step? Well, you schedule a visit here in the office with us, and what we do, it's called a neurometabolic consult, and what we do is we do a complete neurological evaluation. We're going to assess your brain function, your central nervous system function, what might be going on that could be hindering your healing process from a central nervous system point of view. This is beyond what we do with normal chiropractic. This is an in-depth examination. We also will take your questionnaires. You're going to bring those in with you. We're going to take your questionnaires and we're going to review those. And you're going to bring any lab work in with you that you had done recently. And if you've got enough lab work, great. We'll be able to tell you if we can help you. If you don't have enough lab work yet, I might send you out to get some more lab work done so that we can determine, okay, if this is a process that might be something that works for you. Okay? Now, as I said before, our goal in the office is to reinvent your life. It's to take you from where you are now to a place of much better health. This is not an easy process. My job is to get in here and figure out what's going on, figure out what we have to do to fix it, and coach you in the process of helping you do that, and provide the proper therapies and the proper environment and the proper supplementation to help you do that. But your job is to actually be the one that does it. So this program is not for everybody. So I'm going to give you a couple disqualifiers so you can determine if you want to actually come in for this neurological evaluation. Number one, if you're a smoker, there's no way that you're going to achieve optimal health if you are smoking. Every time you smoke a cigarette, you're bringing in toxins. I'm not saying this is a judgment, this is just a fact that you will not heal as much as you want to. So number one, if you're a smoker, especially a heavy smoker, and you're not willing to reduce it or maybe go to e-cigarettes or stop smoking altogether, if you're not willing to change that habit, then don't bother scheduling the consult, because it's a lifestyle change that's going to have to be made. The other factor is, you can ask yourself, on a scale of 1 to 10, how motivated are you to change? Because there will be challenges that will come up. There will be things that I'm going to ask you to do that may be causing damage to your health that you may not want to do, but you're going to have to do them. So you got to have that motivation factor and that strong enough why as to why you're doing this. So if your motivation factor on a scale of 1 to 10, 1 being, I really don't care, I'm fine, 10 being, I need to do this now, I need to fix this now, I'll do whatever it takes. If your motivation level is not at least an 8, then don't schedule a consult, because you're not going to have the motivation to do this, and I'm not going to drag anybody through this. Like I said, my job is to coach, to help you figure out what's going on, and to show you the right way, but it's your job to do it. So if you're a smoker and you're not willing to change, and if your motivation level is anything below an 8, don't schedule a consult with us. Please don't schedule a consult with us. That's wasting your time and it's wasting my time. Who should come in? Anybody who is willing to make the changes that are necessary. Anybody who has a web of physiological dysfunction that looks like that. When you come in, I cannot guarantee you right now that I can help you. Just because you're here does not mean that I'm going to accept you into the program. We only accept about 30 to 40% of the people that come into the office into our program. And it's several factors, motivation factors, what their goals are, whether or not they can continue, or what their condition is. Okay. So what we do is we set up this initial consultation, and we're going to go through everything, and we're going to determine if you're a candidate for our program, and if you are somebody that we can accept into the program. And if you are, great. There's nothing that will help you more than this program. And that's my personal belief. There's nothing that will help you more if you are a candidate for this program. Nothing will help you more than this program will. If you're not a candidate for the program, I'll do my best to direct you in the right ways to find the treatment that you need, and I'll let you know you're not a candidate for the program. Okay? So how do you set up this appointment? Well, I'm going to have a button below this video where you can pay for this initial consultation. Now, the consultation runs $125. That includes that neurological evaluation, the lab test review, questionnaires, if we shoot any x-rays, if they're medically necessary. It includes everything that we do in that first visit. Okay, but I'm putting a deadline on a special offer. Since you've watched this video, you've already filled out your questionnaires, and you have a basic understanding of what we're doing. If you go ahead and sign up for that and go ahead and pay for it in the next 7 days, then you can get that initial consultation for $60. So you click on the PayPal button below and go ahead and pay your $60 through PayPal, and then you'll put in all your information there, and our staff will contact you to set up your initial consultation. So that's what I recommend that you do, and we'll give you more details on how to prepare for your initial consultation. We'll get the paperwork out to you and everything once you get in there and sign up for that. Okay, and this is for new patients. It's also for chiropractic patients that might be coming in for this consult, because this is a totally more in-depth process than what we've gone through chiropractically. Also, a lot of you are from Pensacola, and we do work with a lot of patients from Pensacola and Mobile. I actually have a guy contacting me from Dubai that wants to come in and work with us. So we work with a lot of people at a distance. So if that's your situation, go ahead and sign up for that consult, and we'll walk you through the process of how we can do this at a distance. All right, I hope you find this information helpful. Email me if you have any questions, and I look forward to hearing from you all very soon. Have a great day.